First, we'll go over chlamydia. Chlamydia is a sexually transmitted bacterial infection, and the typical causative agent of chlamydia is the bacterium called Chlamydia trachomatis. The morphology is gram-negative, obligate intracellular bacteria. They also depend on the host cell for intermediates, including ATP. Chlamydia exists in two stages: infectious particles called elementary bodies that are small and rigid, and then intracytoplasmic, which is reproductive forms called reticulate bodies, which are larger and metabolically active. As listed under morphology, also they could be individual or clustered as cocci, and they spread during sexual intercourse or using objects. Moving on to the signs and symptoms of chlamydia, it is oftentimes asymptomatic, which is why it has a nickname of the silent infection, because the majority of people who have it, which is 50 to 70%, never even notice any symptoms. In females, symptoms include smelly white, yellow, or gray discharge, painful intercourse, bleeding in between periods, and itching around the vagina and burning when peeing. And in males, it includes mucus-like or clear watery discharge from the penis and burning sensation when peeing. And the image to the right just explains all of this as well. Treatment includes a single oral dose of azithromycin, which is an antibiotic, and then an alternate regimen includes doxycycline. Prevention is just using condoms during intercourse. If chlamydia is left untreated, females can develop pelvic inflammatory disease, which occurs when the chlamydia damages the reproductive organs, which can lead to infertility and chronic pelvic pain, which leads to the second bullet point, which is pregnancy complications like preterm delivery or passing the infection to the fetus. In males can develop epididymitis, which is an infection spreading to the testicles and the tube that carries sperm to the testicles, causing pain, swelling, tenderness, and reduced fertility. So the epidemiology of chlamydia is that chlamydia is the most common STI caused by bacteria, with 1.5 million cases reported each year. The growth in the cases have steadily increased from 700,000 in the year 2000 to 1.5 million in 2021, which the steady increase is not necessarily due to a true rise in infection rates, but it's largely attributed to expanded screening programs, improved diagnostic techniques, and just greater public awareness about chlamydia. And also, where is it most common? Rates are higher among women, and chlamydia infections disproportionately affect non-Hispanic Black populations. So one case study that I discovered is a case that took place in Thailand, which involved an 11-year-old girl who had symptoms of rhinorrhea, cough, mild fever, and discharge from the eyes. On examination, the chest radiography revealed hyperinflammation, and periocular infiltrates indicate of pneumonia. So testing confirmed chlamydia was the infection, and the treatment consisted of oxygen therapy and a 7-day course of oral azithromycin suspension. And an interesting fact about chlamydia is that it's one of the smallest genomes of all bacteria, consisting of approximately 1.04 million base pairs.
So this is the pathogen description for trichomoniasis. Trichomoniasis is a sexually transmitted infection caused by a protozoan parasite. The causative agent of trichomoniasis is Trichomonas vaginalis. That is a flagellated protozoan that colonizes the human urogenital tract. Its morphology. Trichomonas vaginalis is a pear-shaped, single-cell, anaerobic eukaryote. It's measured to be about 10 to 20 micrometers, has 5 flagella, 4 of them are anterior, and one of them is incorporated into the undulating membrane that facilitates movement and attachment. It exists only in its trophozoite state, so it lacks a cyst form and can phagocytose host cells and other microbes. How does it spread? Almost solely through vaginal intercourse. The estimated transmission rate between partners is 60 to 80%. Survival outside the host is brief. Rare fomite transmissions via moist objects have been suggested but have remained unconfirmed. So we're going to discuss the signs and symptoms of trichomoniasis. It's oftentimes asymptomatic. With females, there's frothy greenish yellow discharge, vaginal odor, itching, dysuria, pain during sex. A strawberry cervix may also be present due to localized inflammation. For males, there's urethral irritation, discharge, and burning during urination or ejaculation. So treatment and prevention of trichomoniasis. A single oral dose of metronidazole or tinidazole can be used to treat it. These drugs cause damage to the DNA in the parasite and ultimately kill it. Resistant cases may require multi-day treatment regimens. If trichomoniasis is left untreated, pelvic inflammatory disease may occur. It can persist for months and even years. It can increase the risk of getting HIV, and complications with pregnancy may arise, such as preterm delivery or low birth weight. The epidemiology of trichomoniasis. Globally, trichomoniasis is the most prevalent curable STI. 156 million new cases are estimated annually. In the U.S., it affects women more than it affects men. Where is it most common? Rates are especially high in underdiagnosed and underserved populations. Disproportionately high rates of trichomoniasis are seen in African American women and individuals from lower socioeconomic backgrounds. These disparities can be linked to lack of screening and access to health care. A study at Planned Parenthood in the United States was taken place where 13% of screened women were tested positive for Trichomonas vaginalis. They were tested by nucleic acid amplification testing. Most of them were asymptomatic. Reinfection rates dropped significantly lower when partner treatment protocols were followed. Unlike many STIs, trichomoniasis is associated with an increase in microbial diversity. This disrupted microbiome may increase susceptibility to HIV and affect immune response in the reproductive tract. Trichomonas vaginalis infection can lead to or exacerbate bacterial vaginosis, also known as BV. It's a condition where the balance of bacteria in the vagina is disrupted. BV is characterized by a decrease in the beneficial lactobacilli and an increase in other bacteria, creating an environment that is more susceptible to HIV.